Hello, hello everybody. We're ready. So hello everybody. I'm here again. So today we have another interesting case. So every day we have nice cases, but not every day we have the chance to do a lot of transmission. But today I would like to show you how to deal with benign stenosis after uh, biliodigestive anastomosis. So this is a 30-year-old male. That's correct. That was submitted 6 months ago to a cholecystectomy. So during the cholecystectomy, they have adverse events, and they have to perform uh, biliodigestive anastomosis due of the situation. And one of the big problem of this kind of surgery is to have a stenosis of the anastomosis. So I will try to show how to deal with this. So guided by US, because we cannot perform any kind of treatment for a moment for ERCP, and until few years ago or several years ago we had this kind of problems because we didn't have any other option. Some of the option has been proposed many years ago also as using enteroscopy, but this is a time-consuming procedure. So today I will try to show you what we can do it, okay, and to evaluate the strategy to do a very good treatment in this patient. So first I am at the level of the liver, and I can see first that this patient have very dilated intrahepatic biliary tract. So how is the level of bilirubin? Bilirubin está en cuánto? So 14, okay? So when we have this, so I can see here is 10 millimeters of diameter of this. So we have two kind of strategy. First, if I arrive to do it something, so is to try to perform a balloon dilation by antegrade treatment and to see the anastomosis by cholangioscopy guided by US. This is a very nice and new technique. This is a hybrid technique that I believe is part of the future. And the second, if the stenosis is completely closed, I think we can arrive to do it biliary drainage to the stomach, because what I see here, I have 18, almost 20 millimeters. I will measure again. Let me see. 20 millimeters, yes, but the dilation of the biliary tract is almost 10 millimeters. So I am thinking probably also to use an axios to drain here and to have an axios directed to the stomach. So in this situation will be better. Okay. So I don't know. I will see. First, we need to do cholangiography guided by US, and this is the approach that we will perform. Second is very interesting also to measure here the distance from the wall of the stomach to the biliary tract is 16 millimeters. It's nothing. So less than that. I believe it's 13 millimeters. So to do an axios is not a bad idea. Okay. So now I will do my first approach using a new endoscopic ultrasound needle. So this is the Microtech needle, 19-gauge needle. So this is a very new needle, very good. I like it. I really like it, and I like it overall the design and the easier how to use the design of the handle. That is very good, and it's a very good also the distal part of the needle, so we can see very well during our procedures. So now I am using a Pentax scope 4.0 millimeter working channel, and this is important to have a therapeutic scope. Okay. Now I need to pass my needle first. So now the needle is okay. And now I will do my approach here. So we will use so I think the best position is here. Let me see here. Okay, here. So you see my needle is very well observed. So now I am inside the biliary tract, as you can see here. Okay. So I have the fluoroscopy, please. Fluoroscopia. So I already put saline solution in the middle. I flush with saline just to see, you see, like this, it is coming blood or not. So it's coming the bilis. Okay, so now I am very good. So you have the image. I need la imagen del el ecógrafo primero, por favor. So the distal part of this needle is very well observed. You can see here, huh? It's very, very good. I like it. So now, so I will flush with saline solution. You see, it's very important to retire the whole air. And then I will use contrast. And I need to see the fluoroscopy. Fluoroscopía, por favor. So you can see very well. Okay, para. No hagas nada. So this patient have cholangitis y más contraste. I need more contrast. I need to see very well the whole biliary tract to do the right strategy. Okay, see. Because if we see that contrast pass through the anastomosis, that will be good. Then we can do antegrade balloon dilation. So now we are doing just contrast now. I don't see the pass of the contrast, huh? Salina. So I will perform a small dilution first with saline. No, más salina, más contraste. So I already use also. I already done antibiotic treatment. This patient is hospitalizado. ¿Este paciente o no? Sí. Is in another hospital, and they sent to us to see if we can solve and find a solution to him. So I don't see the path of the contrast, huh? Salina. Quiero ver más arriba. So you see, so this is the biliary tract, and I am in a very posterior area. So I don't believe that we will arrive to cross, because if there is not fluid going inside the small bowel, so this is the anastomosis. So you can see at the end of the biliary tract in the distal part there is an anastomosis. So I will try to pass a guide wire. Dame una guía. Let's go to see if we can do it. If not, the second option is to do un ratito. Is to do an axios, as I already mentioned. Okay, I will try to pass the guide wire here. You see here? Probably we can have some chance. So let's see that. Okay, now I need to change. So it goes there, but you see, I don't have any chance here. Okay, so now I will push my guide wire. Okay, empuja la guía. And I will use okay, vamos a retirar esto. And I will use an axios, okay, to do anastomosis to the stomach. It's very important to see your guide wire. Necesito que me tenga el endoscopio aquí así. Ahí, viendo la guía, ¿ves? Right. So now I will use an axios. ¿Puedo ver la imagen ecográfica? Ahí ve. 10 por 10. ¿Me puedes preparar un colangioscopio de 9 milímetros? Okay, empuja. So now I will pass my axios. I will create a fistula between the stomach and we are just at the level of the cardia, a little bit down. And my idea is to evaluate then inside using a cholangioscope, knife French cholangioscope of Microtech. So this is the idea of this treatment today, okay? So if you have any questions, you can do it. For those people who are looking live. Okay, now. What? Ahí. ¿Lo ves? ¿Tiene aquí? Ahí. Okay. I need to push a little bit more.